Hand hygiene and aseptic technique serves as the foundational title for this comprehensive educational series. This course is designed to bridge the gap between historical practices and modern clinical standards. We will explore the critical importance of preventing infection through rigorous hand hygiene protocols and the application of aseptic techniques in various healthcare settings. Understanding these concepts is not just a matter of following rules, it is a fundamental pillar of patient safety and professional clinical practice. Throughout this presentation, we will examine the science, the methodology, and the practical implementation of these life-saving procedures to ensure the highest quality of care and the prevention of healthcare-associated infections. The table of contents outlines the 10 essential lessons that comprise this curriculum. Lesson 1 covers the historical evolution and theoretical foundations of infection control, providing context for modern practices. Lesson 2 explores the microbiology of the skin and transmission dynamics to understand how pathogens spread. Lesson 3 details hand hygiene agents and chemistry, focusing on the tools we use. Lesson 4 demonstrates hand hygiene protocols and techniques for practical application. Lesson 5 introduces the principles of asepsis and the ANTT framework. Lesson 6 discusses personal protective equipment, or PPE. Lessons 7 and 8 cover clinical procedures for standard and surgical ANTT. Lesson 9 focuses on surgical asepsis and operating room behavior, while Lesson 10 addresses implementation, culture, and occupational health. Section 01 focuses on the historical evolution and theoretical foundations of infection control. This introductory section is vital because it establishes the scientific journey from ancient misconceptions to our modern understanding of germ theory. By studying the history of infection control, we gain a deeper appreciation for the evidence-based practices we use today. We will look at how early pioneers faced resistance and how their discoveries eventually transformed medicine from a dangerous gamble into a precise science. This theoretical foundation is necessary to understand why specific protocols, such as hand washing and sterilization, are non-negotiable in the contemporary healthcare environment, and how they continue to evolve with new research. Lesson 1.1 examines the pre-germ theory and the miasmatic paradigm. Miasmatic theory suggested that disease was caused by particles from decomposing matter, known as miasmata, rather than microorganisms. In surgical practice during this era, instruments were rarely cleaned, and surgeons frequently moved between performing autopsies and surgeries without washing their hands. The hospital environment was characterized by overcrowding and poor ventilation, which was believed to concentrate these harmful miasmas. The clinical consequence of these beliefs was devastating, leading to extremely high mortality rates from hospital gangrene and puerperal fever. Finally, the educational relevance of this period highlights the significant danger of relying on empirical observation without a correct theoretical underpinning to guide medical practice. Lesson 1.2 focuses on Ignaz Semmelweis and the epidemiology of puerperal fever. The observation made by Semmelweis was a distinct mortality gap between Clinic 1, staffed by doctors and students, and Clinic 2, staffed by midwives. The hypothesis he formed was that the transmission of cadaverous particles via unwashed hands from the autopsy room caused childbed fever. The intervention he implemented was mandatory hand washing with a chlorinated lime solution before any patient contact. The result was dramatic, as mortality dropped from approximately 16% to less than 2% within months. Despite this success, the resistance was strong. The medical community rejected his findings, finding it offensive that a gentleman's hands could ever be considered unclean. Lesson 1.3 introduces Joseph Lister and the birth of antiseptic surgery. The theoretical basis for his work was the application of Louis Pasteur's germ theory to the treatment of surgical wounds. The chemical agent he chose was carbolic acid, also known as phenol, which was used to disinfect instruments, hands, and surgical dressings. His methodology involved creating a chemical barrier to prevent both airborne and contact contamination during procedures. The impact of Lister's was profound, as it drastically reduced rates of gangrene and allowed for the safe performance of complex abdominal and orthopedic surgeries. His legacy established the fundamental principle that the operative field must be chemically treated to be truly safe for the patient. Lesson 1.4 covers the germ theory of disease as developed by Pasteur and Koch. Pasteur's contribution was demonstrating that invisible organisms are the actual cause of fermentation and putrefaction. Koch's postulates provided a set of criteria to establish a definitive causal relationship between a specific microbe and a specific disease. This scientific validation provided the essential why behind the success of hygiene protocols that had been observed empirically. This led to a major shift in focus from controlling vague miasma to controlling specific biological agents. The modern relevance of their work cannot be overstated, as it forms the very foundations of clinical microbiology and infectious disease diagnostics used in every modern hospital. Lesson 1.5 details the chain of infection model, which illustrates how diseases spread. The infectious agent is the pathogen itself, such as bacteria, viruses, fungi, or parasites. The reservoir is the environment where the pathogen lives, including dirty surfaces, water, or human skin. The portal of exit is the method by which it leaves the reservoir, such as through a cough, blood, or an open wound. The mode of transmission describes how it moves, typically through contact via hands, droplets, or airborne vectors. The portal of entry is the way it enters a new person, often through broken skin, mucous membranes, or catheters. Finally, the susceptible host is the person at risk, particularly immunocompromised, surgical, or elderly patients. Lesson 1.6 discusses the transition from universal to standard precautions. Universal precautions, established in the 1980s, focused primarily on blood-borne pathogens like HIV and HBV in known infected patients. Standard precautions, introduced in 1996, apply to all patients, regardless of diagnosis, assuming everyone is potentially infectious. The scope of these precautions covers blood, body fluids, secretions, excretions, non-intact skin, and mucous membranes. Core components include hand hygiene, PPE, respiratory hygiene, safe injection practices, and sharp safety. The underlying philosophy is the presumption of infectivity, which serves to protect healthcare workers and patients equally by maintaining a constant level of vigilance and protection during every clinical encounter. Lesson 1.7 addresses the burden of healthcare-associated infections, or HAIs. Prevalence is a major issue, as these infections affect hundreds of millions of patients globally each year. Mortality is a significant concern, as HAIs are a leading cause of death, often involving multi-drug-resistant organisms. The economic impact is staggering, resulting in billions of dollars in excess healthcare costs and significantly prolonged hospital stays. Common types of these infections include catheter-associated urinary tract infections, surgical site infections, and ventilator-associated pneumonia. Importantly, the preventability of these conditions is high. Up to 50% of HAIs are preventable, primarily through the simple but consistent application of proper hand hygiene by all staff. Lesson 1.8 outlines the regulatory and advisory bodies that govern infection control. The WHO provides global leadership through initiatives like the 5 Moments for Hand Hygiene and multimodal strategies. The CDC offers detailed technical guidelines through HICPAC for hand hygiene, isolation, and device management. The Joint Commission, or TJC, enforces national patient safety goals related to infection control during hospital accreditation. APIC is a professional society that provides implementation guides and ongoing education for practitioners. Finally, compliance with these standards is not optional. It is both a regulatory requirement and an ethical obligation to ensure patient safety. Adherence to these guidelines is a hallmark of professional medical practice and institutional accountability. Thank you for completing this first lesson on the historical and theoretical foundations of hand hygiene and aseptic technique. We have journeyed from the early days of the miasmatic theory to the revolutionary discoveries of Semmelweis, Lister, Pasteur, and Koch. We have also examined the modern chain of infection and the regulatory frameworks that keep our patients safe today. Understanding this history is the first step toward mastering the practical skills required in a clinical setting. Please ensure you review these foundational concepts thoroughly, as they will be the basis for the practical techniques and protocols we will discuss in the upcoming lessons. Your commitment to these principles is essential for excellence in patient care.